Hi, my name is Sophia. I'll be your nurse today. I am a nursing student here at YSU, and I will be performing a neurological exam, okay, and a musculoskeletal exam.
Okay.
Can you tell me your name and date of birth?
My name is Sherry Thompson. Birthday October 8th, 1950.
Okay. All right. And what brings you in today?
Well, I went downstairs and I was going to make some breakfast, and I ended up tripping over my grandson's toys.
Okay.
When I fell, I had hurt my wrist, and 2 hours after that, I had got a massive headache.
Oh, okay. And can you tell me when did the headache start?
2 days ago.
2 days ago? Okay. And can you tell me where is the pain located?
On the right side of my head.
Right side of your head?
Yeah.
All right. And tell me, how long have the symptoms last?
For about 3 hours.
About 3 hours? Oh, okay. And can you describe the headache?
Like this throbbing pain, like a heartbeat.
Okay. And can you tell me, when does it get worse or better?
It gets worse when I'm standing up and I'm walking.
Okay.
Better when I'm laying down and resting.
Okay. And does the pain radiate anywhere?
No, it doesn't really radiate anywhere.
No? Okay. And is there any pattern with your headache?
I don't think so. I wouldn't say there's a pattern.
There's not a pattern? Okay. And have you tried any over-counter remedies or any medication?
No, just the medicine that I'm prescribed.
Okay. All right. And have you experienced this before?
No.
No? So this is a new onset for you.
Yeah.
Falling. You don't typically fall, do you?
No, I'm very aware of my surroundings.
Okay, that's good. And I'm going to go over your medication list, okay? And I just want you to confirm that these are your current medication that you are taking. All right, so I do have my Lexicam 7.5 milligrams daily.
Yeah, my doctor did prescribe that.
He did, okay. And I do have valsartan, which is 162.5 milligrams. You take that for hypertension?
I do.
You do? Okay. And I also have metformin, 500 milligrams. You take that twice a day?
I sure do.
All right. And I have Farxiga, which is 10 milligrams. You also take that daily? All right. And meribertric, 25 milligrams daily.
Yeah.
And rovastatin, 10 milligrams daily. And bupropion, you take that for your depression?
Yep.
Okay. And you take 50 milligrams daily. I do have noted that you have a sulfa allergy. Do you know you have a sulfa allergy?
Yeah, I do.
You do? All right. And some of the symptoms you get when you do take that medication is like shortness of breath and like a rash. You get a rash as well. All right. Okay. So what I'm going to do first is I'm going to listen to your heart sounds, okay? And then I'm going to listen to your lung sounds just to make sure that they are normal and we don't see or hear any murmurs or anything like that, okay?
All right, sounds good.
Sounds good, all right. All right, so I'm gonna listen to your heart sounds here. I'm gonna start at your aortic. Pneumonic. Nerves point. Tricuspid. Mitral valve. So, your heart sounds were normal. I don't hear any murmurs or any gallops or anything like that. So, and your right rhythm is pretty good as well. Looks like your respiration's about 16, so that is good and reassuring. So now I'm going to listen to your lungs, okay? And can you sit up for me? Oh, let's see your lung sounds. Here, just breathe in and out. And I'm also going to see your lung sounds laterally, okay? And your lung sounds is clear. No adventition lung sounds at all. All right, so now we're going to start your musculoskeletal exam, okay? And we're going to start with your cranial nerves 2 through 12. I'm going to start with your optic nerve. You can take your glasses off if you want. I'm going to have you cover one eye here. I'm just gonna just stand up a little bit. And I just want you to tell me, what do you see?
2. I see 3. 3.
Can you cover your other eye?
2, 4, 3.
All right, good job. So now we're gonna check your cranial nerve 3, 4, and 6, which is your oculomotor, your trochlear, and your adducent. And I just would like you to follow my pen line, okay? And I'm looking for nystagmus, and I'm going to check for accommodation. And that is good. Your pupils are equal, round, reactive to light and accommodation. Your pupil is 3 millimeters, okay? So that is good and reassuring. I am now going to check your trigeminal nerve, which is cranial nerve 5. I would like you to bite down for me. Bite down. Thank you. And then open your mouth for me. Okay, thank you. And I'm just looking to see any brain stem compression or anything that would show any deformities. So now I am going to test your cranial nerve 7, which is your facial nerve. And I'm going to have you close your eyes for me and open them. Thank you. And then I want you to smile, puff out your cheeks, and frown. Thank you. Your cranial nerve 7 is intact. I am now going to listen to your cranial nerve 8. I'm going to stand back a little bit, and it's your acoustic nerve. I want you to cover one ear.
One ear?
One ear, yes. And then I'm going to whisper to you, and you let me know what you hear.
3.
All right, can you cover your other ear for me? 4.
4.
Thank you. So I'm now going to test your cranial nerve 9, which is your glossopharyngeal. I would like you to say ah for me. I'm just going to inspect your uvula.
Ah!
All right, thank you so much. No aspiration risk. I don't see anything in this midline. Your uvula is midline, not off to the side, so that is also reassuring. I'm now going to check your cranial nerve 10. It's your vagus nerve. I'm going to have you swallow for me. Can you swallow? Thank you. That is also good. It's midline and it's strong. I'm now going to test your cranial nerve 11, which is your spinal accessory, and then your cranial nerve 12, which is hypoglossal. Can you shrug your shoulders? Thank you. Can you then stick out your tongue for me? Side to side, up and down. All right, thank you. That is also reassuring. All your cranial nerves 2 through 12 are all intact and no deficits noted, okay? So that is also reassuring. I am now going to test your musculoskeletal system. I'm going to have, and it's going to have to deal with you moving your right wrist as well. Let me know if you get uncomfortable or need me to stop at any moment, okay?
Right.
I'm going to ask you to squeeze my fingers. All right. Do you feel any pain?
This hand I do.
Okay, all right, that is good. I'm now going to have you, I'm going to just feel your arm.
Ow.
I'm sorry about that. And I do notice a little swelling here. I'm going to check for your capillary refill. And it's less than 3 seconds. I'm going to do the same here. Less than 3 seconds. And then I'm going to check your radial pulse. And it is 2+ bilaterally, so that is also reassuring. I'm now going to check for cockbelly, and I'm just going to manipulate your wrist back and forth. You let me know if you feel any pain. And you,
it hurts right there.
Oh, sorry about that. Okay, let me do this one. All right.
Feel fine.
You feel fine there? So your strength in your left hand is 5 and 5, and your right is 3 out of 5, which makes sense because you had a fall and you're feeling some pain in your right wrist. So that is okay. All right, so I am now finally going to have you sit up a little bit more, and I want you to press down like a gas pedal, okay? So I just want to test your strength, okay? Can you
I
press
haven't
it?
driven in a while, but okay.
You haven't driven in a while? Okay, that's no problem. Can you press down like a gas? Okay, your strength is 5 out of 5. So I am now going to have you stand, and I'm just going to look at your gait. I just want you to walk back and forth, okay?
All right.
Do you need some help?
Oh, I think I got it.
All right. So just walk back and forth, and what I'm just looking to see is smooth transition. Go ahead for me. Okay, and back over. Smooth. Your posture is appropriate for your age, and that's understandable. And your smooth stride. You can take a seat now. Okay.
Thank you.
You're very welcome. So,
I'm sorry.
No, you're fine. So based on your assessment today, your cranial nerves are all intact. Your coordination and strength is normal. And your gait is steady. Your headache appears to be mild and related to your recent fall, which is understanding. And your wrists show minor pain, but no deformities, okay? So likely I would say that you have a post-traumatic headache with a minor right contusion, okay, to your right wrist. And there are some things I want to discuss with you and what I would like you to do over the next couple days, okay?
Mm-hmm.
Because you are 73 and develop a new right-sided headache after a fall, I want to be extra cautious. Even though your neurological exam looks normal today, and people of your age can sometimes have a delayed brain bleed, and right now it doesn't show symptoms right away. So what I want to do is order a CT scan with no contrast, and I think this will be a best test to look for any injury, bleeding from a fall, okay?
Mm-hmm.
It's quick, it's safe, and it will help us make sure nothing is going on, and it will also ease you as well. You have any questions about that?
No, I think you did a pretty good job today assessing me.
Okay, thank you. And that will be outpatient. I'm going to send you a referral to go to the hospital and get that completed, okay? Some of the other things I do want to do for you is if you notice any confusion, vomiting, any visual changes, weakness, or difficulty walking, I want you to go to the ER right away, okay?
All right.
Some other things you can do is take Tylenol. Tylenol is also, you could take that because it does not interact with your meloxicam, okay?
All right.
I do want you to stay away from any Advil or Aleve because that's contraindicated with taking Mobic, okay, meloxicam. All right, I do also want you to follow up with me within 2 to 3 business days. If symptoms get worse, I want you to give me a call. Oh, don't forget, because of your wrist, I want you to rest that wrist. I also want you to apply ice. You can use it for 15 to 20 minutes on and off throughout the day. That should give you some release. I also recommend a wrist splint for your wrist. You can get that as well. I can give you a referral for that. And I want you to elevate your wrist when you're seated, okay?
All right.
Do you have any questions for me?
No, I don't.
All right, well, thank you so much. It was good seeing you
It was good
today.
seeing you too.
I want
Thank
you to
you,
get
Sophia.
better, okay?
Thank you.
You're welcome. And you also mentioned that you didn't take any over-the-counter medication.
No.
Only what you had
Yeah.
taken, only your prescribed medication.
Mhm.
All right. Did you use anything, like any remedies to help relieve the pain over the last 2 days?
No, I didn't, but my husband recommended me to put some ice on it, but I didn't put any ice on it.
You didn't put any ice on there?
No.
No. What about it? Did you do anything else to, because sometimes when you put ice, it relieves the pain, especially for any like swelling, to reduce that, and that would have been a good idea.
I've been resting it.
You've been resting?
Yeah.
How about, have you been elevating your arm?
Yeah.
You have?
Mhm.
And did that give you any relief when you did that?
Yeah, it gave it some good relief.
Some good relief?
Yeah.
Okay. Well, that's really good. And when you did elevate your wrist, did it feel warm or cold to touch or anything like that, or
I would just say like regular body temperature.
regular body temperature?
Mm-hmm. I
Okay.
wouldn't dare, sweetie.
You